Thank you very much, Umaben. So just to summarize, with this panel, what we've seen is in this activity that's financed by Safansi, we've identified 3 different ways of identifying, doing gap analysis at the community level that works within the particular context. We've identified a number of innovative practices and entry points at the community level, and then we've also started identifying enterprise models, moving into a business footing, which I think is where we have to go with food security. I mean, it's a food business. So what we're seeing is the evolution. Now, where the Bees Network comes in is that this is a regional learning network. It has representatives, one civil society organization, at least one from each country. We have 15 members right now, and we also have some of the bank-financed programs. And the idea is to move this knowledge around through learning exchanges, through exchange of documents and documentation of good practices. Now, this has already happened. It started happening. This is kind of phase 2 of our program. But I understand that Manusha Jona Foundation has already visited Bhutan and has taken away one innovation that you plan to pilot already. And if you could just, Shamim, briefly, in 2 minutes, explain the innovation that you all plan to pilot.
Actually, we visited Bhutan and we saw that there are some innovation which we can replicate in our context. And frankly speaking, some of the challenges are same in Bhutan and Chittagong Hill Tracts, especially around the remoteness and the population. So we found there that they are using some post-harvest center at the village level, which is very much effective because the farmers who produces products, they bring it to the post-harvest center, and there they can do processing. They can preserve the product so that they can sell it when it is not the season. And also they can value add to the product by adding something. So we found it very useful, and we have some similar things in our Chittagong Hill Tracts program, that we have natural cold storage, but it is not as effective as Bhutan is doing there. And we have some food products that we can keep, and we can add value to that so that they can be sold in the market in higher prices. So we bring back that information to our area, and now we are planning to for a pilot project where we can have in a complex natural cold storage, a food processing center, which also can include the solar dryer, so that it will be cost effective, and also it is scarce, electricity is scarce in Bangladesh, you all know that. So I think that would provide the farmers, including the women who are producing different things in different seasons and can value add and increase their income. So that's the thing. Thank you.
Okay, thank you. And just to close the loop on that, so we've had Bangladesh already learning from Bhutan. We're going to have Vilutu traveling. There'll be exchanges among all of the members. I think there are plans for all of them to go and see the Rudy Multi-Trading Company. And, you know, the Pakistan Poverty Alleviation Fund has already expressed interest and is planning to take the gap analysis and pilot that in 5,300 households, and then they can take that to scale nationwide in Pakistan. So using a network approach, we're able to identify innovation, move it quickly, and then take it to where we can scale it up. Because Manusha Jona Foundation has, what, 100 and how many partner organizations?
122.
122 partner organizations. So what they learn with one partner organization can quickly scale up to 122. Pakistan Poverty Alleviation Fund similarly has 127, so they can go nationwide. So the idea is to move innovation around quickly. So that summarizes the kind of the story of this panel, and we'll open it up to any questions. And also we'd like to hear what others are doing so we can take some ideas back to South Asia with us. Okay, I see a question. 1, 2, 3. Do we have a microphone?
Can I start?
Gitanjali, could you hand your microphone to the lady in the brown or? Okay, and then we'll come to you, madam, after that.
Thank you very much. I'm Vijayaratna from Ministry of Agriculture, Sri Lanka. Very happy to note, Visakha, that you are working with the government extension officers. And as you all know, the government can't reach last 5 to 10% of the population because of lack of resources as well as the knowledge gap. Knowledge gap is always there. And we from the government policy side, we want the extension officers to work with private sector as well as the social groups. But we really have a problem with their attitude because the government officers at that level, they think they have the authority, they think they know everything, so they don't want to work with the private sector. No, that is the actual situation. But I understand that you work very nicely, so I'm very happy. Can you kindly elaborate what are the activities you are doing with them and how can we take it with the other extension officers? Thank you.
Thank you very much, Dr. Vijayaratna. It brings our old friendship back, renews it today, I must say. Yes, what we essentially did was to invite transparently from the first training onwards, government officers, including public health midwives, public health inspectors and your extension staff. And they were actually also on a journey of learning methodology which is interactive and so on. And with great keenness and alacrity, when we said, okay, let's visit a very good project of the Ministry of Agriculture, where women are selling, healthy produce, healthy food in Peradeniya. Actually, the bus was given by the Ministry of Agriculture, Eastern Province. And that was negotiated by the extension officers. Now we have been having the village walks, where they are identifying outlets and products, and they are also actively. So I think the secret here is including them and touching them at a certain level to say, look, maybe the ministries are a little on the policy side, but we are really on the ground at the impact level. Why don't you come and, make your plan our plan and vice versa? I think that's what it is.
Okay, we have the lady in the brown jacket and then the gentleman in white shirt.
All right. Thank you very much for the informative presentations. My name is Nancy from the African Union. Maybe my question has been partly answered, but I like the way you put it that, some of your advocacy and partnership is about telling our story. And I just wanted to know, how do you tell your story to the government and how do you tell your story to the private sector? Because maybe the civil society, you're much more used to them. And you've said that, you try to involve them from the beginning. So apart from the ones you involve from the beginning, how do you tailor your information? Maybe you go to a panel where their government ministry and all that. Is the way you communicate with them, is it different from the private sector?
Thank you. Another very good question, I must say. Let me give you an example to begin with. The survey that we did, as I said, Sri Lanka invests a lot into the infant, especially, and the pregnant mother. So people are also very protective of the territory. And all our divisions are looked after by a medical officer of health and several midwives. Now, when we came up with our assessment, one of the questions in the survey was, just when you go house to house, the women, check the growth monitoring record of the child if there's a child under 2 years of age. And they came up with this figure of 35% of 100 children whom they came by were underweight. Now that is very high for Sri Lanka because our national standard is 21%. So this showed 35%. And the medical officer of health was very reluctant to accept. So what we did was we had an advocacy session with their staff, with our people, the community presenting. And he was unhappy. So we said, okay, through the project, we will give you refreshments and, a little bit of cost. Why don't you bring all the growth monitoring charts to the office and you count? And this is under embargo. We won't send it up to the Ministry of Health till you are okay with it. And now we are doing that. So, and also telling our story through innovation. Now we have asked the community to prepare little machines, as I said, tools, recipes, and there is going to be an exhibition day. First in the division, then at the district, then for all major stakeholders at national level, where people, the community, will present their innovations and ask for support. So that is telling our story, really.
Chimi, Shamim, Uma, do you want to add anything to that? Because Uma, I know you're working with the private sector, and Chimi, you're
I
very
think
close.
in Bhutan we have it a little easier. We don't really have to work very hard to convince because the government knows where the gaps are, and they're quite cognizant of the fact that they cannot reach the last mile, as the Agriculture Deputy Secretary, Deputy Minister already mentioned, as is the case in Sri Lanka. For us, we use our foundation day. We have a 3-day fair at which we invite the parliamentarians, we invite the council members, we invite everyone who's anyone in government to come and attend, and we kind of hold them captive and tell our story, or let our community members tell their side of the story. And so it kind of raises the awareness level, and then we supplement that with a lot of interactive sessions. We work rather closely with the government officials, both at the local level. It's essential, because we cannot move things otherwise. And we also involve policy decision makers at the parliament level. And so it's a multi-pronged approach, and it generally works.
In Bangladesh, it is a problem because, there is denial because in Chittagong Hill Tracts, the situation is a bit different, and so there is denial, and that's why we took that initiative to involve the government people right from the beginning, because now we are developing the toolkits and guidelines for the gaps we have identified at the field level, and there are some thing which is not duly given attention at the policy level also. I can give another example of education system. In our country, the education policy includes that when a school gets registration from the government, that should have some number of students and distance from one school to another, but the situation in Chittagong Hill Tracts is very different because it is a hilly area, so the students studying in a school is very less number, but they cannot fulfill the criteria. But the government people are ignorant about the situation, so it is but the things are changing, after the signing of the accord, but still it is a challenge. And for the private sector, that is another threat for Chittagong Hill Tracts, because it is a place where it is a resourceful place, and it is a place of scenic beauty, and lot of private sectors, people are going there, buying the land, and they are owning the land, and so again, it is shrinking for the farmers and for those population. So but the other hand, another positive thing is they are producing organic things. So now it has become popular. So that's the catch. We want to trade off things with this type of things, So.